Okay, the last lecture for our unit on the integumentary system covers two big homeostatic imbalances of the skin. The first one would be skin cancer. So, skin cancer is, for the most part, relatively benign, meaning that it does not spread or metastasize, and it's not what we consider dangerous. Some tumors, though, can be cancerous, and we call that malignant. When a cancer has malignancy, that means that it will invade other body areas, which could potentially lead to some big problems for the person who has it. Skin cancer, of course, the main risk factor would be overexposure to the sun. That's why it's very important that we always try to protect our skin using sunblock whenever we're out in the sun. But there's also been some recent research in the last decade that shows that skin cancer also has a very high genetic factor. So if skin cancer runs in your family, this would be something that you would need to be a little more careful about as well. So the first type of skin cancer that we're going to discuss is one called basal cell carcinoma. So basal cell carcinoma is the least malignant. It's the most common. And what's we find with basal cell carcinoma is that it's usually on areas of the face where the sun hits it a lot. So you're going to see it around like the cheeks, the nose, the ears, the forehead, places like that. It starts off as kind of like a shiny dome-shaped knot, and then eventually will kind of rupture like an ulcer, and you'll see these pearl bumps around the outside, and then more of a reddish area on the inside. Basal cell carcinoma is very slow growing, so it takes it a while to get to this size that you see in the picture. And the good news is an individual with basal cell carcinoma has a 99% cure rate once they remove the basal cell carcinoma. So it's very important to have it removed at an early stage. The next skin cancer is called squamous cell carcinoma. Squamous cell carcinoma looks a lot different than basal cell carcinoma. It usually forms in the keratinocytes that are found in the prickly layer, stratum spinosum. And it starts off as kind of like a scaly bump. Sometimes it can be a red bump. To me, it kind of looks almost like a really bad patch of dry skin. We find it on the scalp. We found it in the ears. We find it on the lips and on the hands. So 8 places where the sun would hit it pretty frequently. Squamous cell is a lot different than basal cell because it grows very rapidly and it spreads. And it can spread into your bloodstream and then it can move to different areas of the body. For squamous cell carcinoma, it's very important to catch it early in order for you to have a complete cure. I lost an uncle a few years ago to squamous cell carcinoma. It started as a spot on his cheek, and by the time he finally had it seen about, it had begun to spread throughout his face and eventually into his brain. So squamous cell carcinoma is nothing to take lightly. If you find a place that looks like this, you would need to go and have it seen by a doctor as soon as possible. The last skin cancer is melanoma. Melanoma is the most dangerous skin cancer, but luckily we only find it in about 5% of skin cancers. The problem with melanoma is that you can find it from anywhere that there's ever been a pigment. It could be from a pre-existing mole or freckle or spot. Sometimes it can just pop up on its own. So a melanoma, one of its key characteristics is that it changes colors. You'll see an area of black, an area of brown, and it kind of fades in and out. The problem with melanoma is that it spreads rapidly downward, whereas the other ones kind of spread side to side across the epidermis. Melanoma may not get quite as big on the surface, but where it's growing is deep into your dermis. And then it gets to the blood vessels and eventually the lymph nodes, and then it has access to anywhere in the body. If an individual has a melanoma that's 4 millimeters thick, survival is very poor for that person. So the key to surviving melanoma is early detection and early removal. And these are some pictures of melanoma. The ones on the left are extremely noticeable. You would probably have those removed pretty quickly. The ones on the right, though, are a little more subtle. This is basically a little bit bigger than a normal size freckle, but I blew it up so that you could see the changes in the colors and how it fades in and out. And then right here, this is something that, is pretty common on individuals, but would need to be watched pretty closely. So if you have a spot that's kind of suspicious, the best way to check it is by using what's known as the ABCD rule. So in areas that you are exposed to the sun on a regular basis, or for melanoma, it doesn't even have to be in the sun, you would use the ABCD rule. A stands for asymmetry, meaning that it has a very asymmetrical shape. Border irregularity, like I showed you on those others, it kind of fades in and out, so it's really hard to tell where the spot starts and where the spot stops. Color, if it changes color or changes color throughout the spot, that would be something to be wary of. And then finally, diameter. If it gets bigger, pretty rapidly, then you need to be concerned about that as well. There is an E, which stands for elevation. Usually if you have a spot that you can feel because it's raised above the skin, that E stands for elevation, and you don't have to worry about those because usually if it's puffy, it's nothing that you really have to be concerned about. So the next homeostatic imbalance is burns, and this is actually going to be your discussion question. So you're going to imagine you're a doctor in a hospital and a patient's brought to you with severe burns, and I want you to explain the steps that you would take to treat this individual. So burns are tissue damage, or cause tissue damage, and burns can be caused by heat, electricity, radiation, or chemicals, and in some cases they can even be caused by friction. The biggest problem with burns is not infection, which a lot of people think. The first thing that we have to be concerned about is the loss of body fluids. When we're not maintaining boundaries, and that means that we can lose fluids through the skin or where our skin was, and that leads to dehydration. Then dehydration, of course, can lead to renal failure, which is where your kidneys shut down, which then leads to circulatory shock, and this can kill you. So in order for you to make sure that an individual that has sustained burns is taken care of, the first thing you have to worry about is their fluids, and we have to replace those using a formula that tells us exactly how much fluid to give. So that formula is called the rule of nines. So basically it's an estimate. We look at the body, we determine what areas of the body have been affected. We divide that. The body is divided into 12 areas, and each area is given a percentage. We add those percents together, and they tell us what percentage of the body has been burned. Then, based on the individual's height, weight, and age, we know how much fluid to give that individual. You can't give too much fluid because that will flood their lungs and will cause them to basically drown. But if you give too little, then they'll dehydrate and go into renal failure. And this is a picture of what the rule of nines looks like. And you've probably heard people talk about this before. If they tell you that someone has sustained a certain percentage of third-degree burns on their body, this is what they use to calculate that percentage. So after we've given them fluids, the next thing we need to be concerned about are calories, because they've lost their tissue, they've lost their fat storage, they've lost a lot of the things that they would need in order to build new tissue. So we replace that those calories through an IV, and the calories will be in the form of proteins and sugars that our body will use to make new tissue to heal where we've been burned. The last thing that we worry about is infection. Infection is a major threat, but we don't have to worry about it for 24 hours because for 24 hours, the skin is too hot for anything to live on it like bacteria or fungus. So after that 24 hours is when we would need to be concerned about bacterial or fungal infections. So for 24 hours, you can use that time just to treat the first threat, which is dehydration, the second threat, which are the calories, and then lastly, prepare for infection control. Burns are classified based on how bad they are. A first-degree burn is only the epidermis is affected. And if you look at this picture right here, this child pulled down a pot of hot water, and you can see their chest. They have a lot of redness. First-degree burns cause redness, swelling, and they hurt really bad. And usually a first-degree burn heals up within a matter of about 3 days. If you've ever gotten a sunburn, you had a first-degree burn. Now, if you look at this child's lips, you'll see that they've developed blisters on the lips. Those blisters are indicative of a second-degree burn. So second-degree burns, the upper part of the dermis is hurt as well as the epidermis. So because of that, they separate and form blisters. And then just like first-degree burns, they're going to be very red, they're going to have some swelling, and it's going to be extremely painful. Second-degree burns usually take 3 to 4 weeks for them to heal. And then the worst one are the third-degree burns. Let me go back. Here's a picture. This is a former student of mine, Maddie Pygott. She splashed hot grease on her hand. So you can see this was in just a few minutes after the burn. This was a couple minutes more. She's beginning to develop blisters. And then you can see this is what happened shortly thereafter, and she ended up having to go to the hospital for it to be seen about. So those are second-degree burns. Third-degree burns are the worst burns. So this is a picture of a foot that has sustained third-degree burns. And then this is a picture of an eye that has sustained a chemical burn, which is considered a third-degree burn as well. So third-degree burns affect the entire thickness of the skin, epidermis and dermis. They can be anywhere between gray-white to a cherry red and even have blackened areas. The good thing about third-degree burns is luckily most of them are not that painful in the area that you sustained a third-degree burn. So if there's any positive to a third-degree burn, that would be what it is. However, I will tell you that around the third-degree burn, the person's going to obviously endure some second and first-degree burns, which are going to be extremely painful. But third-degree burns, in the worst burned areas, the nerve endings are destroyed and they may not hurt. Third-degree burns are usually healed with grafting, which is where they take skin from either a donor or from another area of your body, and they put it over the part of the skin that has been destroyed. Third-degree burns take a lot longer for you to heal from. Burns are considered critical if over 25% of the body has second-degree burns, if over 10% of the body has third-degree burns, or if you have a third-degree burn on your face, feet, or hands. Those would be considered critical. So that wraps up Unit 3, the integumentary system. So please go back and study through your notes. Make sure you review all of the videos and prepare for your Unit 3 test. Talk to you later.